Hello, and today we're going to talk about care of the patient with a TIA and strokes. We're going to focus on being able to recognize both a TIA and stroke and the long-term care of patients who have suffered a stroke. So we're going to be in chapter 45, but we are only covering pages 927 to 935 and then 938 to 940. The rest of the chapter will be covered in your critical care course, which is 495. Here you can see the student learning objectives. Sorry about that. Here, the student learning objectives. Well, look, that we're always going to prioritize airway, breathing, and circulation during the initial care of a patient who's in the acute or critical stage of a neurological accident. We're going to discuss strategies to provide care and effective transition in care from acute management of the patient with the stroke to long-term care. We're going to develop teaching plans about risk factors for having a stroke. We're going to describe strategies to prevent a stroke. We're going to talk about the psychosocial assessment and discuss how to support the patient and family in coping with the life changes in the result from the stroke. We'll also look at prioritizing evidence-based care for patients with the acute neurological changes indicated from a stroke. And we'll describe the elements of care for the common responses of acute stroke. First, we're going to look at a TIA, which is a trans ischemic attack, and it is a reversible ischemic neurological deficit. It's a warning sign. It's a transient focal neurological dysfunction. It is a brief interruption of cerebral blood flow. The main difference between a TIA and a stroke is the length of time the patient is symptomatic. A TIA is a few minutes to less than 24 hours, and a stroke without proper treatment is irreversible. Chart 45.1 looks at the key features of a TIA. A TIA indicates a high stroke risk, and reoccurrent and multiple TIAs increase the risk of permanent brain damage. So, on admission to the emergency department, they're treated as if they are having a stroke with neurological assessments and laboratory testing, ECGs, and CT scans. But if the event resolves, then they know that it was a TIA and they can see the difference on the CT scan. Major things is to prevent reoccurrence of TIAs and to prevent stroke. We do this by reducing blood pressure. The most common risk factor for a stroke is hypertension. We'll talk to them about taking an aspirin or an antiplatelet medication. We'll talk about them controlling other risk factors for stroke, such as diabetes, and lifestyle changes such as smoking cessation or to eating a more heart-healthy diet. So again, a TIA is a trans ischemic attack. It is a transient focal neurological deficit. And the main difference is the length of time the patient is symptomatic. With a TIA, it is only a few minutes to less than 24 hours. This is a poster that is seen in a lot of doctors' offices. It's from the American Heart Association. It talks about calling 911 if you suspect that your loved one has had a stroke. But if you look at these 10 signs and symptoms of a stroke and then look at the key features of a trans ischemic attack on chart 45-1, they're the same. There's absolutely no difference. So we never treat a TIA any differently. We always assume that the patient is having a stroke until it has been ruled out, because the longer that we wait to treat a stroke, the more permanent disability can occur. This is very similar. It's from the National Stroke Association. Again, this is seen a lot of times in doctors' offices. I've seen it I saw it in subways in New York, but it's from the National Stroke Association. Again, this is for public education. It talks about the BFAST, which is loss of balance, loss of eyesight, facial drooping, arm, speech difficulty, and then it's time to call 911, because just like with a myocardial infarction where time is muscle, with a stroke, you're looking at time being the lack of permanent deficit. And here it also shows what happens when you have a stroke. Not only do strokes kill more people, more women per year than breast cancer, it talks about how much it costs to care for, and every 40 seconds in America, someone has a stroke. Some of these are for shock value. They are true numbers, but the thing is they're really here trying to express that there are modifiable risk factors that can prevent either the person reading this poster or their loved ones from having a stroke. Where up to 80% of strokes can be prevented by controlling your risk factors. And again, that's weight, high cholesterol, high blood pressure, and atrial fibrillation. So this is one of those posters that's available to the community so that they can see not only is there risk factors that they may have that they need to modify, but also what to do if they start experiencing some of these symptoms, or a loved one is experiencing some of these signs and symptoms. This is another poster that's seen out in the community. They have this one at my GYN office. This was actually put out by GE. It talks about stroke in women and risk factors that are unique to women, such as taking birth control or hormone replacements, when the risk during pregnancy, the waist size being over 35.2, high triglycerides, of course that's for everyone, and the history of migraine headaches, which is more popular in women. So we just wanted to show that these are other educations that are available to the community and that you will see out and about in the community. So what is a stroke? In the community nowadays, they're calling it a brain attack. And the reason they're calling it a brain attack is because that way people will associate it with the importance that they give a heart attack. Because everyone knows, because it's been publicized longer, that with a heart attack, it's important to get a person to the hospital. So they're trying to do the same by calling a stroke a brain attack, because they are very similar. They're both changes in normal blood supply. And with the stroke, it is change in normal blood supply, of course, to the brain. Again, there are plenty of causative factors, including hypertension, AV malformations, and aneurysms. There are different types. There is ischemic and hemorrhagic. And so there are different types of stroke. All are treated differently during the acute phase. So that will be covered more in 495 as far as treatment during the acute phase. Again, stroke is a neurological deficit related to decreased blood flow to an area of the brain. It is a frequent cause of death and disability, especially with ischemic strokes. The deficit is related to size, area, and length of time that the ischemia is taking place. The first priority, if you know someone who is experiencing a stroke, is they need to get to a certified stroke center. So what are the risk factors for a stroke? There are 3 types of risk factors for stroke. There are those that can be managed medically, there are non-modifiable ones, and then there are modifiable risk factors. For the ones that can be managed with medicine or with medical management, that would be hypertension and diabetes. Because if both hypertension and diabetes are in control, then the patient is at a less of a risk for stroke. Non-modifiable would be family, gender, and ethnicity. The modifiable risk factors are all listed very nicely for us on chart 45-2. Some of those, of course, include smoking. They need to be on a heart-healthy diet, and to manage their obesity. Other modifiable risk factors are also use of oral contraceptives, especially after the age of 35. Using different non-hormonal forms of birth control may be needed to be looked at, especially if patients have other risk factors such as hypertension or diabetes or obesity. Again, modifiable risk factors would be your sedentary lifestyle. Getting up and moving just a little bit can decrease both your cardiac risk factors, including that of a stroke. Before we move on, I'm going to go ahead and stop this video so that we can discuss it more with we'll start up with assessment of the neurological patient in the next video.